From Kentucky KRHIO and Powell County C.A.R.E.S, this is The Local Lens.
Harm reduction accepts that for better or for worse, drug use is part of our world. And that's something we've tried to acknowledge several times, I think, through the podcast. But so if it's going to be there, then we need to work to minimize the harmful effects of that drug use rather than just ignore it or condemn it. And that's another part of our mission with the C.A.R.E.S program is the stigma. And, we try to meet people where they are, no judgment. Condemning people is not going to help them at all.
One reason that I think this is important is, like Stacy said, it's not going away. It's going to be here forever. And if it hasn't touched you in some way, somehow, you should consider yourself blessed. I think every family goes through it to some point in some way, and everybody is affected by it, from the children to the parents to the aunts, the uncles, the nieces, the nephews, their best friends. Everybody is affected.
Because it affects everybody, it's going to take everybody being at the table before we move forward at all in the movement, because you can't just ignore it. You can't just pretend like what we've been doing is working.
So welcome to the table, my friends. You're listening to The Local Lens, the podcast from the Powell County Health Department, where we go inside our community's experience with the drug epidemic. Our show is coming to you from Stanton, Kentucky, nestled at the foothills of Appalachia. So every person in our small town sees with a unique perspective, and what we want to do with this show is go gather all of those perspectives and learn how to look at addiction from all of the perspectives at once. Because the better we see it, the more wholly and completely we see this monster of addiction, the better equipped we'll be to address it and try making our community better and safer and healthier.
So the more people that know what's going on and the different pieces, the different people that are working and what we're trying to do with different programs and grants, and I just think that is the key. Education and knowledge is the key to helping us get somewhere with this.
So let's get into the episode. These are our people using our voices, telling our stories, because no one sees it like we do.
I'm Stacy Crase. I'm the Public Health Director at the Health Department here in Powell County, and a lifelong resident myself here in Powell County. Worked in healthcare, mostly in public health, for 19 years, and for the last several years there's really been a spotlight on harm reduction and just the fact that this issue with drug use is not going away. So what are some strategies that we in public health can do to try to minimize the harm that does eventually come from that? So
what is the most basic definition of harm reduction you could give?
Well, I know typically nowadays we go straight to drugs, with harm reduction, but it's actually a more encompassing term that just means that with any activity, let's see what we can do to put measures in place to minimize the harm truly that could come from this activity. So, it really goes back to even sex ed classes and things like that public health has been doing, and those types of education to prevent teen pregnancy and sexually transmitted diseases. That's a strategy of harm reduction. So it's just been, as of the last several years, that it's gotten a bigger umbrella and actually proven to be very successful with dealing with the drug use issue.
I saw a video a few weeks ago that was probably the most clever way to introduce the topic of harm reduction. It had a cartoon of a guy driving in a car and clicking his seatbelt. That's
there
harm reduction. Or a guy was skydiving and has the parachute. That's harm reduction.
Yep.
So
proper way to install a car seat. We do things like that,
Yeah, we've been doing it for years. We're just applying it to addiction services now.
Yes.
So that's one guest. Let's meet the other guest this week.
I'm LeAndre Knox, and I live here in Stanton. I've been in healthcare in some capacity for probably 20 plus years now. I work for Kentucky Rural Health Information Organization, and we do a lot of IT, healthcare IT stuff, but we also work on the grant side of it. So About a year, 2 years ago, almost, I went to the executive director and I was like, hey, I have this idea. If we have an opportunity to apply for a grant, can we do it? And that's how I became the project director for the Kentucky Opioid Community Healing Project. So with that, with our grant, we will be focusing on 6 counties, Powell, Estill, Bath, Menifee, Morgan, and Montgomery.
So the project was born for Powell County and has grown to expand into 5 other counties since then, but it's really applicable to any kind of community out there. And focusing locally really helps us cover the area better and more in depth.
We have the whole state of Kentucky. Sometimes it's the needs greater somewhere else. So for once, I actually get to be inside the community and give back to the community I grew up in. So I'm so excited about that.
So we're doing a roundtable talk today because, I started working in this about a year ago now, a little over a year ago, and Miss Stacy Crase, you were the person who hired me, and a month or 2 into the job, gave the green light to try out doing the podcast. LeAndre, you're here because about half a year after that, after we'd recorded all of the first season's episodes, you heard about the project, and you said, that's important. We want to make sure that keeps on happening. So the 2 of you were on board with this before there was anything to really be on board with. And that makes me curious why you both think that this is something we need to do. You guys both have sheets in front of you with notes. This I can't tell you the last time that I came to one of these podcasts with a piece of paper. No, I can tell you. I think it was after recording the 5th one, and after that one, I was like, okay, fine, we're gonna wing every one of these now, and it's gone well for me. But what did you guys bring here for us?
Well, I don't know. I've got a few things. When we discussed what do we want people to know about harm reduction, and just sort of almost wrapping up season 1, leading into season 2. What is this all about? And I went back to the episode that I recorded on with Ian Morton, and I was honest in that episode that, even working in public health, and you first hear about syringe exchange, it sounds like that just doesn't seem like that would be what we should do, is hand out needles. But then, when you get the whole concept explained to you, and so I think it's important for people to know that it's okay to be skeptical. It's okay to have your doubts and to seek that additional information. And so why does it make sense to some people? What are we trying to do here? What's the end goal? So I kind of read up some talking points and some different things about, if I were to try to, in a nutshell, explain it to people. And
let's go for it.
This is one that I wrote down.
Go for it.
Harm reduction accepts that for better or for worse, drug use is part of our world. And that's something we've tried to acknowledge several times, I think, through the podcast. But so if it's going to be there, then we need to work to minimize the harmful effects of that drug use rather than just ignore it or condemn it. And that's another part of our mission with the KRHIO program, is the stigma. And, we try to meet people where they are, no judgment. Condemning people is not going to help them at all, and you just have to be there for them. And that's another part that I always try to let people know, is it's not just about, with our syringe exchange, it's not just about the clean needle. It's about that friendly face, that contact at the back of the health department, that they know that person is there and those treatment resources are there, and if they have any questions, then they know where to go. Otherwise, they're just out alone in the world using drugs. And I just, we've heard some of these stories in the first season, and it's heartbreaking and gut wrenching, and so there's a lot of important points, I think, that people need to know about harm reduction.
So it's not necessarily that we want people to be experts on harm reduction. We just want people to be supporters of it, so that there's no public backlash when our health department runs a syringe exchange program or something like that.
I mean, I definitely think there's a learning curve, and I think that this podcast has been good for that, you know, to hear both sides of the story. I think there's a learning curve on both sides because, as you hear in that episode, I learned things from Ian and, you know, some perspectives that he had being a sergeant and, you know, kind of in his line of work that I hadn't thought of before because I don't deal with that side of it. So that's why I think this podcast and just communicating, as small as we are, you know, you would think that we all know each other, we all know what everybody's doing, and we just don't. And so it's been good to talk to each other and really learn from each other. And I do think it's opened up communication quite a bit, so we all feel more comfortable with each other, and think we can have more meetings and different things going forward.
So. We have to destigmatize it. We've got to ask, I mean, as a community even, I feel like we've got to learn how to do that and ask ourselves the question, can we show compassion for someone who has an opioid use disorder or substance use disorder the same as we have compassion for someone that has diabetes? I feel
That's
like
exactly
we
where I was going with
really
it.
have to hone in on that. I think we got to just start actually just having really hard conversations and being honest about it.
Yeah, you know, people make comments about how much weight they've gained during the pandemic and how they're stress eating, and they don't receive the same judgment as somebody that's picked up on alcohol or drug use.
Exactly.
But it's the same coping mechanism. It's just different substances. So I was thinking that way too, as far as my background with being a dietitian and a diabetes educator. When you mentioned, you know, diabetes, it's, of course, when we have patients and we have diabetes classes, we have goals in mind that they need to eat this way, and it's better for them to eat these foods and exercise X amount of minutes every day. But at first, you know, sometimes with people, it's like, well, can you walk to your mailbox and back? You know, that may be where somebody starts. Can you maybe not drink soft drinks? And you just start with very minor goals. And for some reason with drug use, those people, I think, are expected to just cross the finish line. It's either, you know, you're in or you're out. And they don't, I don't know, it just seems like there's a stigma more associated with that. And people don't realize they need all those steps to treatment too and recovery.
Really do.
And some people too, it's important to know, some people never recover. And so you have to look at that population too. You want everybody to, but it's, you know, with any other health condition, some people never quit smoking. Some people never lose that 50 pounds they need to lose. So, you know, with those people, okay, then harm reduction would be, we provide you clean syringes, we provide you Narcan, we provide you education, and that's one way we can meet you where you are again and help you on your journey.
So when you're starting to look at addiction like it's a disease, then it does draw a lot of comparisons to diabetes. Yes, it's not a perfect analogy. There are a lot of similarities, but there are a lot of differences as well, but it's at least a good starting point to start looking at it that way. We're not going to get any further into the science of this right now. Instead, we're going to change directions and start looking at approaches to treatment and to harm reduction. So when you're inside harm reduction, then, where do you think are the most important places to be putting a lot of money in those?
Honestly, I mean, I feel like it's the whole community. Like, there's not one area that I say, okay, let's put like $5,000 right here and just dump all that money there. I feel like it has to be, like, personally, from what I see, it needs to be broken down. I think it's everything, really. I don't necessarily, personally, I don't necessarily think it goes just like in one area from what I've seen.
That's one thing I like about the CARES grant that we got, because we had, every letter of CARES stood for something that, you know, we didn't put all our eggs in one basket. We had the collaboration and community meeting piece, and then the access to treatment and rapid response, education, and then syringe exchange. So there's a lot of different ways that you can get more bang for your buck, I think, and more information out there, because some people will be impacted by peer support, but some people need the education. Just your general community member needs that, and they'll never know necessarily, you know, they may never know about a peer support or what they do, but they may see a video or listen to a podcast.
Hopefully.
Yeah, so.
Hopefully. Tell your friends. So this kind of suggests that you kind of have to throw everything that you can at the wall and just see what sticks, because every place is very different from each other. It depends so much on the people in your community, the people who are being active about it. And that means that you can't just have a government mandated program to fix things. It has to be specific to each place. And we want the local lens to be an exploration of that, to show people what works in Stanton. So why do you guys think that not even just the podcast, but that the whole conversation of harm reduction, of paying attention to the addiction world, why is this important for everybody?
Well, I think that because it affects everybody, it's going to take everybody being at the table before we move forward at all in the movement, because you can't just ignore it. You can't just pretend like what we've been doing is working. So the more people that know what's going on and the different pieces, the different people that are working and what we're trying to do with different programs and grants, and I just think that is the key. Education, knowledge is the key to helping us get somewhere with this. And I guarantee you listen to one podcast and you'll learn at least one thing that, you didn't know, or change your perspective. And then hopefully it stems from there. But
even if the only thing you learn is how hard life is for some people.
One reason that I think this is important is, like Stacy said, it's not going away. It's going to be here forever. And if it hasn't touched you in some way, somehow, you should consider yourself blessed. I think every family goes through it to some point in some way, and everybody is affected by it, from the children to the parents to the aunts, the uncles, the nieces, the nephews, their best friends. Everybody is affected. And I think that for me, I see it so much. Family members, friends, people I went to school with that I was really good friends with, just different ways that I see it in our community. And it's not going to get better until we try to fix it.
And by we mean everyone, all of us together, not just the three of us in the room.
According to the CDC, just last year, 90,000 people have died from drug overdoses. 90,000.
Wow.
In 2020.
That's a lot of people.
That's a lot of people.
Yeah.
I mean, I think that's too one of the reasons when you think about that, that's why we have to change the conversation.
Yes.
I mean, because eventually it hits home, even economically. But 90,000 is a lot.
That is a lot. And then you look at, let's say there's 5 to 10 people, just minimum, whose lives will never be the same because they're super close friends or family of those people, children, sisters, brothers. I mean,
it's just a ripple effect.
Lot of people.
Yeah.
And that's really sad.
So let's do some quick math here. So you have 90,000 people who died from overdoses, and each of them reached 5 other people, let's say. That is 450,000 other people who just lost someone who was really important to them. That's almost 500,000 people. You start dealing with that many people, and then it has to be a public issue, right? Then you have to step in. Your public has to start doing things to try to remedy it and make it better. But then it's difficult because it's so hard to tell if anything that you're doing is actually working. But you still have to keep trying to do things anyways.
And we may not see it next year. We may not see it 3 years from now, but maybe 10 years down the road. Maybe something that we did in some type of a program, or, I mean, just even having a speaker come. We may help someone. I mean, I have a goal in mind. I think with any grant, you want to help as many people as you can, but also my mindset is if I spend all this money to help one person and one person has a takeaway from it, like, that's the best money that I could have ever spent. If I can change one life by doing this grant, I mean, if we all work together and do that, I think that we have been very successful.
I think you're selling yourself short a little bit on that too, because it's not even just changing a life. Because I feel like everything you do, every choice you make changes your life, but it's legitimately keeping people alive.
Yes.
Like, it's at the bottom line is that what's been happening in Stanton is that we're losing way too many lives before we should be losing them. And that makes a lot of Christmases, a lot of Thanksgivings and birthdays much harder to go through for a lot of families. The entire goal is to keep people alive longer. And yeah, no matter, you actually said this in the Ian Morton's episode, it's like their lives just like everyone. It doesn't matter what it is that they're doing that puts it at risk. Like, as harmful as drug use can be, for some reason or another, people use drugs, and it's got to be somebody's job to try to keep people from dying.
Yeah, we wear shirts, public health saves lives, and there's a hashtag, public health saves lives, and it's all lives, and not only save it, but save their family members, their friends from a lot of heartache, hopefully, and I think it was chilling for a lot of people when you listen to the Joshua Jones episode, and to hear him say death was a cool option for him. And how many people get to that point and we never know it? And I'm glad he came back from that point, but just that is not.
It was very eye-opening. That's actually on one of my notes here. Like, I don't have a drug problem, I have a solution. Like, those two things stuck out with me. In that podcast. I mean, there was a lot of others, but those were the two that just, like, wow.
And then knowing that somebody's thinking like that, then that helps inform you as somebody who's trying to help at how you can help. Like, if you can get in, there's a marketing, like, the rule of marketing is to get into your audience's head. And that's got to be the same way with any approach to health stuff. So here, y'all tell me if this is accurate, or if it just sounds too stupid to ever say on record. With public health, the ultimate goal is for nothing exciting to ever happen. Like, for just nothing.
Like, pretty much.
That is the thing that we say. When public health works, you don't know what we're doing behind the scenes. And especially with the pandemic, we've been front and center more, and we'll never be able to prove what we did, because you can't say what would have happened if those public health measures wouldn't have been in place. So it's a very tough position to be in, and sometimes a thankless job. We just do a lot like that behind the scenes. That that's what we're there for, to improve lives, hopefully.
Thank you. Thank you for doing it. You seem to be leading a good ship. So,
I think she's done an excellent job, considering that she was just new director in COVID, and just...
I agree. Everyone go to the closest Starbucks, buy a $15 gift card, and mail it to the health department. They deserve them.
Yes, they do.
So let's focus back in on why we're doing this show then. This is the health department trying to reach our public where you guys are at. We want you guys to be supporters of what we're doing. We want our community to be healthier. Everyone in our community. Statistically speaking, Eastern Kentucky has remarkably poor health. So we hope that this is a different way that we can reach you guys and try to get everyone on board with this.
I feel like the podcast is a way for people to quietly... maybe they did it on purpose because they saw something that made them want to tune in, or maybe they just happened on the radio at the time. That
maybe they just heard me yelling and decided, like, what's this guy yelling about?
And I just think that's the cool thing that has happened, is the blessing in disguise, that it's reached a whole lot more people than it would have if we had had 2 or 3 in-person meeting opportunities. People just don't normally take advantage of those.
And it gives them, like, kind of what you said, they can do it in the comfort of their own home.
It's a heavy show to listen to. I do not understand how I've gotten through doing this job for a year and have kept a sense of humor. Like, it's just kind of crazy, because it's a lot. I don't blame people if they don't want to, like, get online and just broadcast that
Oh,
that
absolutely.
like their favorite thing to do is listen to this show about how addiction is tearing up their community. But at the same time, I hope that people see the importance of it and try to get other people, if you are a listener to this show, try to get other people to listen to it. I say that selfishly because it's my job and I can have a job for a longer time if people are listening, but also because it's important. It'll shape your views, and you don't know how hearing a certain person's story and perspective will change your entire approach to everything.
You don't know what you don't know.
Something I was even thinking, I think I've told Nate this before, but I've been in healthcare for years. I've worked in this for years, but even I've learned new things over, like, almost on every podcast. Yeah. There's something that's a big takeaway, like, I didn't know that, or wow, I wouldn't have realized that. Yeah. So, and I've also cried. I feel like every episode has some point to where I tear up. And I'm like, okay, I gotta quit doing this to myself. But I mean, I come back for more. Not because it is my job, but just because I'm interested in what is going on and hearing those stories and what I can learn from it.
It's all in the spirit of learning, of being better, of being healthier, of being more compassionate to people. Really, we just want people to listen to each other, to listen to the experts who spend their entire life studying addiction. We want you to listen to mothers who have lost their children. We want you to listen to children who grew up without their parents. We really just want everyone to be supportive of each other and to want what's best for everyone else in our community. That is the entire goal of the Local Lens. Anyways, that is all the time that we have for today's show. Thank you guys for listening, and a big thanks to Miss Stacy Crase and Miss LeAndre Knox for coming on the show and talking with me on this. Hopefully it was good information for our listeners. I would also really like to thank WSKV for broadcasting our show. Also a big thanks to the Powell County Health Department and KRHIO for sponsoring the show and letting it be a thing. To our listeners, thank you guys so much for listening to this. But now I'm going to tell you to go tell your friends to listen as well. Tell your family members, your aunts and uncles that you see twice a year. We really think this is important information. We think it's for everyone, no matter where you're from. So go find us on Facebook and help us spread the word. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.